Namaskar, I am Dr. Manaan Gandhi and today we are going to talk about Panchakarma. What is Panchakarma? Panchakarma is an Ayurvedic detox therapy where we basically remove all the toxins and the doshas from the body. Why should we do Panchakarma? Is because, very simply put, if we give medicines to suppress the doshas can always come back and cause recurrence of the disease. Whereas when you remove them completely, the chances of recurrence is zero. Which is why Panchakarma is a great asset to humanity, wherein we can completely eradicate diseases from the root. Two types of people come to me for Panchakarma. The first one is the person who's suffering from a disease and needs resolution. Generally, if the disease is a little major, simply medicines is not resolving it, or if the disease is constantly recurring, then Panchakarma is highly advised. But the second type of people are the more intelligent type of people who come on a regular basis to do Panchakarma so that they don't allow any dosha to be built. So that is a very different sort of Panchakarma that we do, where we are actually preventing problems rather than help cure them. Now, Pancha means 5 and Karma means therapies. So Panchakarma is a set of 5 purifying therapies. The first one is Vaman, which is vomiting. So we will remove the kapha dosha majoritarily through vomiting. The second is Virechan. The third is Basti. The fourth is Natsya and the fifth is Raktamokshan. Vaman, as I said, is vomiting. Virechan means that you have purgation, you have loose motions, and you remove the pitta dosh majoritarily through that. Basti is enemas where you are removing vata dosh. Natsya is when you are removing doshas from the ENT region through nasal instillations. And Raktamokshan is bloodletting where you are actually removing bad blood through multiple methods. Panchakarma is not a one-day process. It requires a lot of pre-processes and a lot of post-processes. So these are things like Abhyanga, which is an Ayurvedic oil massage. Swedan, which means steaming or hot fomentation, right? There are diets that you need to follow. There is a lot of ghee intake in certain procedures. So all of these things are preparations that you do for the major karma, so you don't have any problem like dehydration or any other sort of issues or complications. And after you've done the Panchakarma, the digestive fire of an individual goes very less. So we need to do post Panchakarma therapies and post Panchakarma diets to rejuvenate the digestive fire, to rejuvenate the energy levels, to rejuvenate the immunity, so that after this complete detox, the patient is much lighter, much fitter, much stronger, and actually much younger than what they were before it. So these are very, very complete, very significant detoxification processes. Now, a lot of people come and ask me, where should we do the Panchakarma? So we have so many resorts, we have so many places, we have Kerala, we have Kutch, we have, there's so multiple places where you can actually go and do Panchakarma. Or should we do it in these cities, with these doctors? So my answer is very simple. If you're looking for a spa-like treatment, where you're looking for ambience, where you're looking just to relax, when you're looking for merely wellness, then you should go to these resorts or these places. But when you're looking for specifically medical illnesses and we are talking about medical health, then it's always better to do it in cities where the doctors A, have more exposure to more patients, so they are definitely better. B, you can do it from the comfort of your own home and eat actually home cooked food. And C, the treatments are more designed for medicine than for spa-ish, luxury, wellness sort of treatments. Also, it's much cheaper. The fourth point is that Panchakarma, when done without any disease, just for a detox, should be done in particular seasons for best results, although it may not necessarily need to be done in those seasons. For example, in Varsha Rutu, which is the monsoons, you should be doing enema or Basti. If you are planning to do Virechan, which is loose motions, which is for Pitta, then that is to be done in Sharad Rutu, which is the post-monsoon heat. Typically in India, it's about October heat is what we call it. If you are planning to do Vaman, which is vomiting, it should be done in the Vasant Rutu or spring, which in India is approximately February, March. If you are planning to do Natsya, also it should be done depending on which dosh is high. If it is Kapha, then again spring. If it is Pitta, then again Sharad, which is the autumn. And if it is Vata, then you can do it in the monsoons. Raktamokshan can be done at any given point in time. Although if a lot of Pitta is mixed with the blood, which normally is the case, then Sharad Rutu or the post-monsoon heat is one of the best times to do it. Although there are no restrictions on any of these Panchakarmas, these are simply favorable times to do them. So this is Dr. Gandhi. I have given you the short and long of the Panchakarma. If you have any doubts, if you have any comments, if you have anything you'd like to, reach out to, shout at me, you can shout at me in the comment section. I'll try to be there as much as possible. Thank you.